I'm a cancer epidemiologist, and my research primarily focuses on the role that physical activity plays in cancer risk, cancer survival and cancer survivorship. For lymphoma, I'm currently looking at the association between physical activity and the risk of different types of non-Hodgkin lymphoma using pooled data from various InterLymph studies and also a couple of other studies which aren't included in InterLymph. I'm also looking at sedentary work or sedentary behaviour in an occupational setting and how that might influence the risk of non-Hodgkin lymphoma subtypes as well, because sedentary behaviour is kind of an emerging risk factor for particular cancers. It's kind of distinct, so it's kind of thinking about how the actual kind of act of kind of prolonged sitting influences the risk of various diseases rather than as a distinct kind of exposure from physical inactivity or not doing enough physical activity. So that's kind of an exciting area. So that's something I'll also be able to look at with InterLymph data. On top of those two things, I also look at, in terms of survival, I've published a study where we followed up the cases from a non-Hodgkin lymphoma case control study, and we looked at how their physical activity levels before they were diagnosed with non-Hodgkin lymphoma influenced subsequent survival, and also how their level of BMI or body mass index influenced subsequent survival. And in that study we found that people with the highest levels of physical activity before they were diagnosed with diffuse large B-cell lymphoma had much better survival in the follow-up period than people with the lowest physical activity levels, but no association for follicular lymphoma. But we did find that people who were obese at the time or 1 year before they were diagnosed with follicular lymphoma had about a 3 times higher risk of dying in the follow-up period than people who were of normal weight. So that's quite a large effect, and that's definitely something worth investigating in the larger studies. I've also done a little bit of work on us looking at physical activity and survivorship issues, where we recruited a sample of about 150 non-Hodgkin lymphoma survivors. They were all around 2 to 4 years post-diagnosis, and we asked them to wear an accelerometer on their hip for 7 days. So using an accelerometer we can get a really accurate measure of physical activity levels and sedentary time levels. And in that study we saw that people who had the highest physical activity levels had much lower levels of fatigue and a higher quality of life than people with the lowest physical activity levels. So I think on top of the potential survival benefits, I think there's also those kind of psychosocial outcomes, I think, and there's a few other studies which have shown similar things in lymphoma patients that physical activity can potentially negate a lot of those common side effects which people receive from either their lymphoma or their treatment or both of those things. InterLymph consortium gives a really fantastic opportunity to pool data from multiple studies to really get enough statistical power or really enough number of cases to be able to look at different types of non-Hodgkin lymphoma, and I think that's kind of becoming increasingly I think the evidence is kind of accumulating that these distinct types of non-Hodgkin lymphoma actually may have different risk factors. So to be able to look at, like I will do, be able to look at physical activity and the risk of non-Hodgkin lymphoma. Previous studies have only really had enough numbers to look at all types of non-Hodgkin lymphoma combined, and haven't really been able to separate distinct types of non-Hodgkin lymphoma. So with the data I'll be able to use from the studies involved in the InterLymph consortium, I'll actually be able to really have a really good look at how how physical activity and also sedentary work may influence those individual types of non-Hodgkin lymphoma, and also look at differences between males and females and those kind of things. So I think it's really that opportunity to look at individual NHL subtypes rather than clumping them all together.